My name is Mira Keddis. I'm originally from Egypt, but went to Texas for my medical school training and came to Mayo for my residency training. We had a chance that my husband and I went. My husband is in child and adolescent psychiatry. We had the privilege to go together, and Mayo was very supportive in allowing both of us to go at the same time. We decided on Lake Elementaita, Kenya. Every morning we would round on all the men's wards. So men's had their own hospital area. Women had their own separate one, and children were with the women. And after rounds, we kind of took our chai break. This is kind of traditional Kenyan break around 10 o'clock where everybody stops their work and drinks a cup of tea. They call that chai. And then after that, we kind of started outpatient clinic. And then in the afternoon, we actually had the privilege of being located close by to an orphanage. The orphanage takes care of about 51 HIV-positive girls. We also had a chance to just be more aware of how blessed we are here. One of Dr. Freida's famous sayings was, one extra test is food off the table. And that really kind of stuck with me quite a bit after we left, that every test we order for those patients, for that culture, could mean one less meal a day. And just realize the importance of being cost effective. And in fact, one of the things that he has is every time you order a test, the cost of the test is written right next to it. So you're constantly being reminded of how much it costs. And a huge addition to your education, to be able to see cases of malaria and bad cases of TB and end-stage HIV with all its complications. We hear about it, we learn about it, but we don't see it, we don't put our hands on it. In the orphanage, I was completely heartbroken at the end when we had our last day. Sister Jacinta, she's kind of the leader of the orphanage, called us, said, you really need to come, the girls have something special for you. We had a long day. We went to a rural area trying to care of a sick person there, so we didn't come home until late. But when we went, everything was set up for a party. You have the girls on stage. They sang 2 English songs for us with the dance and the play. And I never knew what kind of impact we had on those girls. I never saw it. But it wasn't until at the end to see that they actually appreciated us being there. I don't think my husband and I would have been able to go if it wasn't for MIHP, Mayo International Health Program, for 2 reasons. Number one, protected time, and they protected a whole month, which is a huge privilege, and I don't know of any other place that would protect your time to do that. I mean, it's paid time. It wasn't leave of absence, or it wasn't stopping my training to go do this and come back. So they made it such a smooth transition. The other aspect is financial. Our flight was paid for. The extra cost that we had while we're there was minimal, and MIHP made it really smooth. And I can honestly say, if it wasn't for them, I don't think my husband and I would have considered it as strongly or even went for it. It gave us just a drive to want to go back. And in fact, less than a year later, my husband had a privilege to go back to Kenya, same place, and unfortunately I couldn't go with him, but hopefully again in the future.